Yep.
Alrighty. So, hi everyone. Welcome to the 14th episode of the Pre-Health Purple Hawk podcast brought to you by the Pre-Health Advising at Hunter College. My name is Chaya Greenberg,
I'm
And I'm
Brandon.
Isaiah King. Oh, sorry.
and you're so fine. And it's our pleasure to welcome Branden Sosa. Branden is a proud graduate of Hunter College's class of 2019, where he studied biochemistry and was part of the Thomas Hunter Honors Program. His path to medicine included two gap years, one during college when he worked as an office manager for an orthopedic surgeon at the Hospital for Special Surgery, while also helping support his family after his mother became ill, and another after graduation when he conducted basic science orthopedic research. Branden later earned his MD from Weill Cornell Medicine, and he is now completing his orthopedic surgery residency at the Hospital for Special Surgery. Welcome to the podcast, Branden.
Thank you
So,
so much for having me.
of course, and I'm sure that this is a question you've gotten a lot, especially during interviews for all different sorts of medical schools and whatnot. But what inspired you to pursue a career in medicine?
It's an important question. I think it's sometimes difficult to really understand where your passions come from, but I think mine kind of roots back to my origins. My family's first generation, coming from Puerto Rico and the Dominican Republic, and I was born here in New York City in the Bronx. But I saw my grandfather kind of struggling with common comorbidities, diabetes, and the complications that would come with that, and eventually he would pass from complications from those diseases. But I always saw that lack of trust with the medical system, and I was always kind of the bridge between my family and the medical system, and that was my first exposure. So that is like an introduction. I started doing more formalized the shadowing. So I did a few summer programs when I was in as early as middle school, I think, which I credit to my introduction to medicine and then eventually my passion for it. So kind of like family background introduced me to it, and then I started doing these mentorship programs that really helped.
Great. Thank you so much. Um, and so how was your journey applying to medical school? I know it's a tough journey. We all have very unique journeys when, referring to it. And do you have any tips for current pre-medical students as well?
Yeah, my path was a little bit circuitous to say the least. I didn't have the typical 4 years of college and then start medical school immediately after. As you kind of alluded to before, I started at Hunter, and then about halfway through my academic journey, my mother became a bit sick, and I decided to take some time off from school to support my family, both financially and emotionally. But it was a great time because through the pre-health department, I had found a shadowing opportunity at Hospital for Special Surgery. Those emails that Camille and Nina send out that have 1,000 different opportunities on them. I was scrolling through one of those early in my undergrad career, so as a freshman, actually. And I had been helping out and shadowing in this orthopedic surgeon's office. Fast forward a couple years later, my mother gets sick and they're losing somebody in their office. And um, I was 19 at the time, so quite young, and his office manager had left. But having spent the last 2 years in his office, I felt like I understood it very well, and we had come to have a strong relationship. And I didn't have the master's degree that was necessary for the position, but he gave me the opportunity to run his practice for a couple of years. So I had the chance to spend time with my family, support them, but at the same time, still spend time around medicine. And then that was really my big introduction to orthopedic surgery, which I would eventually go on to pursue as a resident now. And then you also asked, tips for people applying into medical school. Um, Medical school applications are a beast in and of itself. Your journey there, it's going to look very different than the person next to you. I think it's a process that rewards those who reach out to others for advice and get multiple different mentors at different stages. A mentor can be a friend that's just a year or two ahead of you. Someone who it could be a lit major, someone that's going to help you write your personal statement as far as, an attending or a doctor that you've shadowed or developed a relationship with through research. So, um, my advice to all of the students that I talk to is always to develop a really robust network of mentors, however way, whether that's cold emailing or through formalized programs, and then take your time when it comes to doing well on these standardized tests. The MCAT is probably at that point the most difficult exam that you've ever taken, the longest for sure. So however you need to get there, take your time doing so, and take whatever prep course you need to take and do a lot of practice questions. Sometimes it can be difficult to balance the coursework and studying for these exams. So, coming up with a robust plan where, you've gotten input from your mentors, you've taken the time to carve out dedicated study time. That's a privilege for a lot of us. But if you can afford to do it, if you can find the resources to make that happen, I think that that will go a long way. Having competitive scores at that stage and really at any stage in your career really helps open a lot of doors.
Perfect. Thank you so much for your advice. And so looking over kind of your, background, especially at Hunter, you were definitely very involved and very active with the Hunter community. So my question to you is, how was your time at Hunter, specifically as a pre-medical student, but overall just as a student in general? How was your time?
I think Hunter is it's a great school on so many fronts. I mean, you have incredibly diverse. You have people coming from all different backgrounds in the heart of New York City. So, New York City is kind of our playground when you're not in school, but you have I think from the pre-health standpoint, I think you'd be hard pressed to find another place that puts their undergraduate students in such a good place for opportunities. If you think about it, you are 4 blocks away from Memorial Sloan Kettering, one of the premier cancer institutions in the country, if not the world. You're 5 blocks away from Hospital for Special Surgery, the number one orthopedic hospital in the country. You're a few blocks away from Rockefeller University. There are so many institutions nearby where you can either get involved in research, get involved in clinical care. So I did a lot of that when I was an undergrad, and a lot of my peers did too. You know, Hunter is a commuter school. We don't have the privilege of rolling out of bed and then, 15 minutes before class and riding our bike over and being on time. A lot of the students that were peers with me and were at Hunter had other jobs, were doing, taking a class in the morning, going to their job, and then coming back in the evening for another class. So, I think that's kind of the beauty of Hunter. It's a melting pot in that sense that everyone's journey is very different, but the opportunities are abundant, wherever you turn. So, um, I always felt well supported. I think the challenges that come with there are challenges with every school, and the challenges I think that came with Hunter is it's a really big school, very easy to get lost. And fortunately, we have the pre-health department that does a really good job of making sure everyone's on top of their milestones and connecting them to opportunities. But even within that, it can be easy to get lost. So it's important to try to develop a relationship with your pre-health advisors from day one. I still talk to Camille today, and I started college in 2013. So it's been over a decade, and we still keep in contact.
Wow, it's good to know that Hunter has such a strong support community here. Thank you
Absolutely.
for speaking on that. So now I kind of want to move on to the topic of gap years. I know that for a lot of students, especially myself, it's kind of hard to decide if a gap year is worth it or not. Do I want to go straight in or should I take that time off? So I wanted to ask you if you could discuss your gap year experience. I know you took 2 gap years, and I know they were very different from each other. So if you could expand more on those gap years, what you did, how it impacted you, and if you feel, and do you feel like it was worth it? Like it helped, like, do you not regret taking those gap years? I guess is the question I'm asking.
Yeah, absolutely. I think, sometimes gap years can be done for different reasons. Sometimes life circumstances kind of force them upon you, and then other times, it's just a decision that you make on your own. I think I had both experiences. So for the first one, I had life experiences like my mother being sick, my family needing my support. That kind of forced my hand into that. But then for the second gap year, so I did 2 years of college, and then I had the small 1 year and a half away from school, finished college, and then was about to apply and started, drafting my application, my pre-health application and a personal statement. And the deadline was quickly approaching. It approaches a lot quicker than you realize. And I didn't feel like everything I had everything as tightly packaged as I wanted it to. So rather than rush, I wanted to definitely put my best foot forward, and the pre-health department kind of helped me with that. It was a good opportunity because towards the tail end of college, I started doing more research, clinical research and basic science research at a hospital for special surgery as well, under the lab of Dr. Matthias Bostrom. So a lot of mouse models, infection work, and orthopedic things. So I definitely knew that I wanted to explore that more, but I wanted to give it kind of my individualized, undivided time for it. So that was a good time for me to take a step away from having the coursework, diving into the research, preparing my application to make sure that I put my best foot forward. So again, that's not a decision that comes lightly. I think you have to figure out which one of those two camps you're in, or generally, is this something that, I kind of have to do, or is it something that, I want to do to put my best foot forward? I think both are definitely reasonable reasons to take a gap year. Taking a gap year needs to be done strategically. It's very easy to finally have finished college and then, kind of take a break, or sometimes you are part of opportunities that aren't very well structured. It's not a program. It's sometimes you have to join a research group, or make sure that you're doing the volunteerism, whatever it is that you want to do during that year, that you have a kind of solid plan to pursue to really make it worth your time. I think there is a culture right now that people are taking gap years everywhere. You graduate high school, you take some time before college, and then during college sometimes, and then after college, then during medical school, then during residency. So you can fall into a cycle of taking perpetual gap years at every possible turn. So be cautious of that. I had a really great mentor of mine tell me that there is value sometimes, this is kind of a unpopular opinion, but I agree. There is value sometimes in completing your training a little bit sooner than later, whether for your personal life reasons, or the energy and strength that comes with being younger sometimes helps. So um, I I was kind of taken aback when he first gave me that advice, but I always keep it in the back of my mind before I decide to take another year at some points. But it's something that, have to remember what you're building towards. It's difficult to see because sometimes it's really far, but when you're the attending, taking care of your patient in clinic, once you're 10 years into practice, all of the things that you've done during these gap years undoubtedly influence and make you that much of a better doctor. So to answer your question, definitely do not regret any of the gap years. I think they've 100% shaped the way that I am today. The connections and the mentors that I developed were largely in part due to those years. So if I had to go back, I definitely do those all again.
Great. Thank you so much for that insight. Yeah, because I know it's a really tough decision for a lot of people on if to take a gap year or not. So thank you so much.
Right.
So you got through it. You got through the gap years. You got through the MCAT, all those daunting steps to just get to medical school. So how was your medical school experience once you actually got a chance to get in and do what you've been waiting to do all of college, maybe all your life? How was that experience, medical school?
Oh, it was amazing. I like to joke that, so I went to Hunter and I had all these gap years in between, and I kind of stayed in the Upper East Side and worked at hospital for special surgery during that time. And then I was fortunate enough to go to Cornell for medical school, which is also in the Upper East Side. So, and now I'm in residency in the Upper East Side at hospital for special surgery. So kind of serving 25 to life here, but kind of the best sentence ever. Um, Medical school is great. You will realize this. You see a little bit of this in college, but I think in medical school to another degree, you're kind of bouncing around and getting lectures from people who are incredibly passionate about what they're teaching you. When you're getting a lecture on nephrology, whether you're getting a lecture on cardiology, that person has dedicated their life to become an expert in that field, in that organ system. And then you have the privilege of sitting there for an hour, or sitting there in a small group and talking to them about it. They're imparting that wisdom. So medical school is 4 years of you just doing that. You're like bouncing from talented, passionate educator to talented, passionate educator, and you're just absorbing and absorbing and absorbing. it's challenging. You'll spend a lot of time studying, but I think undergrad and this transition from undergrad to medical school is one of the main times where a lot of people are discouraged and they think that they can't do it. This is an overwhelming process, but then you surprise yourself and you do it. And you're like, wow, that was really hard. I don't know how I did that. I thought this was too much for me. And then you do that again in medical school, and you'll be tested often in medical school because you'll have difficult exams and difficult quizzes and a lot of caseload. But then you surprise yourself again and you're like, oh, I was able to do that again. So then you kind of get into a rhythm where the things that seemed really daunting and impossible to attain are now challenges that you're ready to stand up to and overcome. So I think medical school, you grow so much because you learn a lot and you're doing it with a group of peers, but also personally, you realize that you're capable of, the cliche to do whatever you put your mind to.
Well, I really like that. I feel like it's so interesting to hear everyone's like different perspectives of like medical school and what they go through. But obviously, now that you're finished medical school, you're in residency. So I wanted to ask you how residency is like right now, and is the application for residency different or similar than medical school? And like if you have any tips for people that are listening to this and going through that process.
Yeah, it's the application process is a bit different. Similarly, your grades are important. You're going to get grades at some point during medical school for most schools. You'll be doing research similarly as an undergrad. So your application will have different things in it, but similar academic kind of things on your CV. The process for getting into residency is different in that you make a list of the programs. So you apply to a bunch of programs, you get interviews from some of those programs, and then you rank those programs in an order of preference. And then all of the programs interview all of their interviewees and make a list of their programs. And there's this Nobel Peace Prize winning algorithm that kind of connects your list to their list and creates the perfect match. The reality of the matter is most people don't get their first choice or the ideal place that they want to go to. That obviously varies in which specialties you're pursuing. Some are more competitive than others, meaning that some people dip lower down on their list than others. So I think that in the way that it's most different is that match day, as I'm sure you guys have seen, or for your viewers who maybe haven't, it's a day where you open an envelope and you kind of find out where you're going to spend the next 3 to 5 years of your life. So it's a moment where you're spending that with your peers, with your family, with the faculty at your school. But it can be a nerve-wracking time because you don't know whether you're going to be in California or Seattle or New York or Florida. So I think that's kind of the biggest difference in the process for medical school applications and residency. You kind of get one spot. That's the way the system is created, as opposed to for medical school, you can choose what school you want to go to. Hopefully, you've had multiple acceptances.
Thank you so much. And obviously, the journey for medicine is super long. It's hard and it's tough. So, how have you found time during that process to basically just do the things that you enjoy? And what are those things that you enjoy doing to spend your free time?
Yeah, it's important, and I know sometimes it can be difficult to find time at any stage. I know everyone always worries about whether, college is harder than high school and medical school is harder than college and, so on and so forth. But reality is at every stage it's difficult. And, when you're in that stage, it's, you're not thinking about how much more difficult this was than the last thing, you're going through it there. So having ways to decompress, having ways to, enjoy yourself is incredibly important. I think at first, speaking personally, sometimes I'd feel bad taking time to do the things that I enjoyed because, there's always a list of other things to do for school, for whatever it may be. But quickly you realize, especially I think during medical school, where a lot of your time is unstructured, that doing the things that you love, spending the time with your family, if that's something that you enjoy, like those things make you a better student, make you a better, doctor for your patients. And you shouldn't shy away from doing those things because when it's time to show up, then you're that much better for them. So during medical school, I enjoyed playing a ton of basketball, and our school had an indoor basketball court, which is great because we could play year round. And we had a group chat with over 250 people, and people from Hunter, people from all over the place would come. And yeah, it was great. So every Friday after a quiz, you would find me there religiously running 4-on-4 basketball games. So, um, always done that. When the weather's nice out, the good thing about serving 25 to life on the Upper East Side is that Central Park is right there. So spending time outside, my family's still in the Bronx. I get to visit them often, traveling whenever I can. So it's about being strategic and organized with your time and intentional with it so that even if you have a little bit of free time, you capitalize on it as best you can.
That's so funny. I actually never knew Cornell had a basketball court, but that's really
Yeah.
cool.
It
Um,
in Hall, and they actually just built another building, and they made sure to keep the basketball court. So
oh, really? That's so funny. So yeah, that's honestly, I just didn't know that. But what about now, like your plans after residency? Like obviously you're doing orthopedic surgery. Do you have like plans for when you're done for the
yeah,
day?
not quite yet. My residency is 5 years long. Orthopedic surgery is probably among the longer ones. Or fellow Then most people do a fellowship after that, so one more year. So as you can see, the years can kind of add up and up. I see my like remote family will see me once in a while, and they're like, "Okay, so how many years do you have left?" I tell them I just don't count anymore, and I say that jokingly, but partially you stop worrying about how long it takes, and you just kind of enjoy where you're at right now in the process. There's a beauty in being able to show up and having senior residents and senior attendings taking time out of their day to teach me. And I know that at one point that'll be my responsibility, but there's a lot to enjoy at every single stage. So if you kind of switch your perspective and see it that way, it becomes a lot more enjoyable. After I finish residency, I'll definitely do a year of fellowship. We'll see where or in what subspecialty of orthopedics. I haven't decided that yet. And then after that, probably get a job in an academic center so that I can continue some of that basic science research that we were talking about before. That's an example of how, a time away from school back then will likely influence the things that I do for the rest of my career. So again, yeah, I definitely don't regret taking any of those research years.
Yeah, for sure. Definitely like they just help with figuring out what you want to do in the future. But do you have any like final tips for students or people watching this, whether they're in medical school currently, in residency, or just in undergrad? Just like tips and tricks and things to know.
Absolutely. I think, you know, something that happens to me now on a daily or weekly basis is what we were discussing before. You kind of surprise yourself at the things that you're able to do or the things that you learn or haven't realized that you've learned. So when you're in this process that's overwhelming and you feel like you can't do it, just take a moment to realize that you've done difficult things before, you've overcome those, and this is a higher mountain, but you can climb this one and overcome it too. Um, when you're applying for medical school and whatever other goal you have for yourself, recruit friends, recruit mentors. Don't do these things by yourself. There's a lot of resources online, but there's no better help than, talking to the person that kind of just went through this. And there are a lot of formalized programs out there. With the help of my colleagues at Cornell, when I was a medical student, we started Code Bloom, which is a mentorship, a 9-month mentorship program for students from Hunter College interested in medicine. They learn about health disparities. They get paired with medical student mentors. They get talks from faculty. It's fun. It's hands-on, right? Those are programs like that are great ways to, get formalized mentorship and kind of get a better understanding of how to make a strategic plan so that you're not wasting time and you're maximizing your time. So I think my two takeaway messages would definitely be believe in yourself. You will overcome difficult things. Look back, you already have done it, and try to recruit as many mentors, whether in the formalized setting of a program or even casually. I've developed so many mentors that I've just cold emailed or walked up to in a conference and said, "Hey, loved your talk. would you mind if we grab coffee? And they always end up buying the coffee for you. So at the very least, you get a free coffee, but you develop lifelong relationships that way.
Wow, thank you so much. And I know that was like a end off kind of question, but I still have a follow-up question, so I'm sorry if that's like weird. Actually,
No.
two follow-up questions. One that's like a question I'm sure you've heard many times, and one that I thought was kind of a fun question. First question is why orthopedics? I feel like I kind of if there's maybe some sort of background to that. And two, if there's any professors at Hunter that you want to shout out, or anyone at Hunter that you want to shout out that helped you on your journey, maybe just out of curiosity for fun. But yeah,
Yeah.
just the first question, why orthopedics out of curiosity?
Yeah, I orthopedics is an incredibly rewarding field. I think, the way that we move and preserving that mobility is so important. It's kind of central to who we are as humans and how we interact with each other in the world. And orthopedics has the beauty of, I was on call yesterday and I had a consult to see a baby that was, 8 days old. And we treat patients who are up to 90. And then a couple of days before that, we had operated on someone that was 98 years old. So you can treat anyone in the spectrum of age. You can treat Olympic athletes that are trying to, push the human body to do the most that it can. You can treat, kids that have ACL tears or, grandparents that have knee pain and want to play with their kids, with their grandkids. So, the spectrum of the patients are incredibly great. And you'll see for a lot of the orthopedic surgeries, patients come in a lot of pain and disability, and then they come back and see you in clinic, and they're doing great. They're walking down the hall, they're incredibly thankful, and you've given them the agency back in their life that they've lost or been craving for so long. So, from a clinical standpoint, I think orthopedics is incredibly rewarding. Um, it's also really fun. It's one of the specialties where you have to have a good knowledge base and um, what is the diagnosis, what is the treatment, how do you work up, whatever pathology they may have, but then that's not enough. Is you can be an expert at that, but then you have to learn the technical skills as well. So being in the operating room is something that I would recommend everybody explore. You'll do a little bit of it in medical school, but if you get the opportunity to shadow someone, highly recommend it. But it's an environment where there are a lot of people. It takes I don't know, over 10 people to do one surgery, and that you have anesthesiologists, you have nurses, circulators, the folks that are cleaning the room, the folks that are preparing the patient to get there. So it's a very well orchestrated, almost dance, I would call it. And as a surgeon and the patient, you're kind of in the middle of all of that. You get to work with a lot of people, and when it works well, it's a really fun and beautiful sight. So um, those things made it kind of a no-brainer for me to pursue orthopedics. And then your second question, shout out for anyone at Hunter. I have to absolutely shout out Nina and Camille. They were instrumental in all that I was able to do at Hunter. From helping me find my first shadowing opportunities to many others during Hunter. Uh, they have a big task on their hands to help a lot of people. And if you think about the number of people that come through their program, sit down in their office, and the number of patients that they treat, it's, they're making a really big impact on the world. And, they may not see it because it's all second, third hand, or like I said, there's 1,000 years of training. So it takes some time to see that fruit flourish. But, I convey my gratitude to them all the time. But yeah, I'm glad to have the opportunity to do it in this podcast setting as well.
Yeah, and you're definitely an example of that, that work that they've done. So,
Very kind.
um, yeah, thank you so much for these amazing responses. I'm sure there's a lot of, I know there are going to be a lot of students that are going to be very much have learned a lot from this. So thank you so much. I've learned a lot today. I might
Yeah,
even
me
consider
too. Thank
orthopedics,
you.
even though I didn't want to touch surgery at all. But it sounds really I think it does sound like it's like a community almost, like a team, which is
Yeah.
honestly the main reason why I wanted to join medicine in the first place, because it's just how you get a chance to just work with nurses, doctors, just that whole entire just team building aspect, which I just love. Um, So
Absolutely.
hearing,
I think there's the team aspect of orthopedics is probably unlike any other. You've kind of caught me at I'll say inopportune time. You see me with this mustache. I normally don't have one, but there's a unspoken tradition to when you're on a trauma service, you kind of grow out your beard and or your mustache. But it's a high volume, a lot of hours, but you're spending time with a group of 3 or 4 residents and you're taking care of a community. So the team aspect is, you're going walking in together, driving into the hospital together, is definitely there. I would implore you to explore orthopedics. I'm happy to help you do that if you are so interested.
oh, thank you so much. All right. I'll follow up on that. But otherwise, yes, thank you so much for speaking with us today. It was really nice hearing from you. And otherwise, please best of luck on the rest of residency. I know it's tough. But you've gone through medical school. I'm sure you can get through residency. And yeah, best of luck on everything.
Absolutely. Thank you guys so much for taking the time to interview me. It means the world. If there's anyone that has any questions about orthopedics or anything at all, I'm happy to speak with anyone. You can reach out to Camille and she'll give you my number. You can text me. I'm happy to chat with anyone.
Beautiful. Thank you so
Thank you so
much.
much.
All
Yes. Have
right.
a wonderful rest of your night.
Bye bye.
Bye.